is like that. Psychophysiological disorder where psoriasis or atopic dermatitis which are flares with stress, and primary psychiatric disorder like delusion of parasitosis, or secondary psychiatric disorder where a disfiguring skin disease like acne. Acne sometimes is not a major disease, but in particularly the young age group causes some disfiguring scar, and that can cause lot of secondary psychiatric disorder. Even we have seen suicide. And chronic certain condition, no clinical entity we see, but the patient complains of like vulvodynia or scrotodynia, chronic pain of the vulva or scrotum. These complaints sometimes we have to deal, but this is nothing actually from our part, we can't do nothing. Ultimately, we have to refer to you. And this is just the condition where also we use certain psychotropic drugs. This is an urticaria, we use doxepin, because doxepin is a very potent antihistaminic property. And also post-herpetic neuralgia, we are nowadays using gabapentin to actually inhibit the neurotransmitters. Now this skin and psyche, if we just classify, one part is that effect of the skin on the mind, and other part is effect of the mind on the skin. Now if we see the effect of skin disease on the psyche, many skin diseases we know actually leads to emotional problems. Especially I told, if it is an exposed part and is a cosmetically obvious area like psoriasis, atopic, ichthyosis, acne, hair disorder, now is a very common problem. And most of these businessmen on this commercial, they are exploiting this weakness, and lots of, say, crores of rupees are going on as advertisement, and actually these young people are being squeezed by this. So this part, that's why we as a doctor should be very sympathetically dealing with these particular persons, those who have young men or women who have hair loss. If we ignore them, it's nothing much, then they are going to actually false hope with false treatment, and that we are seeing nowadays. Lots of, see, actually criminals, I can tell it is a criminals, they are exploiting these young boys or young girls, those have mild problem, and they are doing in guise of scientific things, they are just minting money. And acne, we know, especially in young age group, this teenage, acne is not a major disease, but when we deal with these young adults with acne, we have to be very sympathetic and very careful, because I personally got patients who had committed suicide from mild acne, young, about 18 years old. So nowadays, and also for this media hype, this which are not disease, they are coming as a disease. 10 years old, they are telling, I have dark shades around my eyes. And that is actually not in our books, but this media is creating disease. And that is also a chronic agony in our teenage groups. So this acne, even some people are chronically depressed, and also they are very stressful. And this is another way, like eczema of the hands, sometimes cause, or eczema or psoriasis on the hand, sometimes cause loss of job, and that indirectly comes a monetary problem, indirectly can affect the mental status. This is just a reverse effect of the mind on the skin. We have seen emotional trauma of a particular patient can give rise to lots of skin problems. And many skin diseases, I already told, is precipitated by stress, like acne, herpes simplex, psoriasis, alopecia. These are not caused by stress, that I am not meaning. I am meaning it is precipitated. And alopecia areata, discoid eczema, pemphigus. These are mostly autoimmune disease, but autoimmune factor nowadays is being told stress factor is important to actually induce these autoimmune diseases. And for this psychological problem, patients sometimes damage themselves. They are creating their own damage to the skin, and probably it is some attention deficit, attention seeking disorder that you can highlight more. And these we are getting very small amount of problems, young boys and girls both coming with their parents to show that something is happening, so do something. And probably skin is a very important organ for this ventilation of the emotions. Now few common psychodermatological conditions, just I am highlighting, probably you are dealing all, and we are also facing this problem very regularly. First is dermatitis artifacti. I have shown one case, trichotillomania, delusion of parasitosis, neurotic excoriation, acne excori. dermatological non-diseases and dysmorphic syndrome. What is dermatitis artifacta? Mostly it is seen which area of the body is accessible to the patients. So that means center of the back we normally spared, the patient cannot reach there. And actually by clinical morphology we cannot prove that is a particular disease. We cannot conform to a particular skin diseases. Then we doubt it. But definitely it is sometimes very much misleading and we think we did biopsy but ultimately coming as a dermatitis artifacta. This could be ulcers, burn, blisters, crustings, even skin disease. And peculiarly we see the lesions are developing very odd places, like psoriasis, we know it is extensor, like atopic, we know it is flexus, but these is not coming in a particular pattern, it is coming in different odd areas. If we see the ulcers, again ulcer I showed one, is a bezier septate, very uniquely margined, it's not a very well circumscribed, and in spite of lots, we don't get any improvement. And definitely I told it's a very difficult sometimes clinically to diagnose. Sometimes we have to do tests because before sending to you, we have to do certain our workup. Otherwise, by chance, if we miss something. And with occlusive dressing, we sometimes get improvement, but ultimately the source, these psychiatric problems you cannot solve. So ultimately, we must refer to you. Some of the dermatologists do themselves give anti-psychotropic. This I am very much against. I think nowadays we should not do that. We definitely refer to you. This is not our job. You should solve the problem. So this is dermatitis artifacta. This is a very unique. No clinical description of any skin disease is conforming with this type of border. It's not tuberculosis, nothing. So it is a dermatitis artifact. The management, definitely we should have a good rapport. If you first day we tell it is you are creating the disease, the patient don't believe it, patient don't trust me, patient go to the other dermatologist. So definitely if the sympathetic approach we should try to do, and direct confrontation definitely we should avoid. And definitely I always personally do some take for psychiatric help. And the problem I just discussing before my speech that in our country some myth or some reason patient when you refer don't go to you but don't go to other dermatologists. That is a real problem. Sometimes we cannot convince. This dermatitis artifacta cigarette burn, but our vasculitis typically cause this type of ulcers and scar. So when first day we see, we may think of it as a vasculitis, but later by sympathetic approach or clinical queries we can get it could be a case of dermatitis artifacta. Trichotillomania, all we know that is pulling and twisting of the hair, and this cause not a well circumscribed hair loss, it is a patchy hair loss. And that patch, I showed the picture, is irregular. Alopecia areata, another disease we see, this is autoimmune disease, exactly like this, but this is a well circumscribed, very well defined margin. And there we get some exclamation here. Here trichotillomania, we won't get that. And sometimes we get scarring alopecia, that is area is inflamed, but it is not that. And no scales, in psoriasis we get scale, lichen planus we get scale. Most important diagnostic clue, the hairs are of different length, what I have shown in the last picture. That is a very important diagnosis. From that, when you see this type of patchy loss, alopecia areata will be total loss usually. And the border is very well defined, but it is trichotillomania, the border is not well defined. And hairs of different length is a very diagnostic feature of trichotillomania. Occlusion of the patch or sometimes was seen by counseling patient helps, but most of the patient we have to do. Dilution of parasitosis, again a very important problem we sometimes face. The patient feels that some parasites are crawling or biting on the skin. In spite of convincing, when you try to convince, patient don't believe it. They sometimes comes with, you have seen probably this type of patient, yes. They comes with the plastic bags or container with filled up of lots of skin debris. Of course. So they sometimes pick with their fingernails or even by tweezer or needles, and they come with this and they have to show you, they must want to show you these things to the doctors. And as a doctor, we know it is a dilution of parasites. Still, our duty not to ignore this thing. We normally want to see, and I myself do by magnifying glass, I try to see this thing, what you have brought. Because many doctors say, no, nothing, this is a rubbish thing. This we can't tell to the patient. Very first, then the patient is annoyed and they don't believe us. So later you can gradually come to the feeling that, but most of the patient again, definitely we should refer to yourself. But the thing is that first day or second day, we should try to have rapport with the patient. We see lots of scratching marks, and sometimes patient may have pain and paresthesia. These are different types of plastic bags and container with the patient comes with the skin debris. We see many skin lesion, mostly it is excoriated. Other few skin disease like dermatitis herpetiformis or some scabies, this can cause to same type of eruption. So we have to first exclude that problem. And very interestingly, some of this problem actually start from a skin disease. So patient may have scabies. We tell you had some mite infestation. The patient have in mind, so his mite or her mite is continuing, still not cured. We have seen certain patient to start with some scabies or some mite infection. After that, it is going on. But definitely, probably the patient have some psychological inner conflict, which is causing this. And mostly we have seen this, the middle-aged people, often women. This is extreme form of delusion paralysis. Patients with this tweezer and also mirror is trying to find out the mite. And definitely it is our duty to first rule out the pathological causes, and definitely it is a very serious problem and patient really suffer. And again, when we are wanting to refer, patients sometimes don't want to go. Even we have seen cases the patient is selling their houses to get rid of these mites or this insect, they go to other, change their house. This is another very common problem, this neurotic excoriation. Actually, yesterday I saw a lady, 1 week back she came with a lot of treatments before. She had extensive itching and excoriations. So somebody thought it's scabies, somebody thought it's a dermatitis herpetiformis. But I had keep in mind that why she is not being cured in spite of show medicine.